It's Dr. Greg here with the Line Wellness Center. Today I want to go over a detailed shoulder evaluation with you so that you guys know what you should be looking for when you go to your providers in them looking to understand what may or may not be going on with your shoulder. So I'm Dr. Greg. I've been helping people to remove the blockages from their health for the last 20 years. Today I've got Eric with me. He's one of our team members. You want to say hi?
Hi.
He's been helping us in some videos here and there. If you want to go back and search through our channel, you'll see some of his better ones. So thanks for helping us out with this. We're going to go through and just do some of our tests to try and figure out and understand the shoulder, okay?
Okay.
So some typical tests that you'll wind up finding that a medical provider might do, or any provider, would just test the overall muscle strength within the arms and or the connectedness of the muscles to the body. Now when I do this test right here, this is a test of his triceps muscle, a muscle right back here. But when I wind up pulling his hand towards him, it's really hard for him to hold it. So in our office, I look to figure out, does he have a triceps issue? Or is the triceps not getting the messages from his brain, which go down his spine and out the nerves? So I like to have him change his neck position. So turn your head this way and look up. Keep that there, don't let me move you. Was that a lot easier?
Yes.
So what that winds up telling me is that he doesn't have a tricep or a shoulder issue, but he's got a spine issue. So for a lot of people who've been having problems with their shoulders, the reason why they become so chronic is that it's not necessarily a shoulder issue. It's where the shoulder connects to the body, and that's in the cervical spine. And how the information is getting from the brain through the cervical spine out to that shoulder to allow for it to hold on to the body. So now we're gonna do a quick adjustment for him. Turn your head this way and look up. And this is one of the types of adjustments that we do within the office. I'm using a tool called an arthrostim, goes like that, makes a noise, provides a bit of an impulse, and what we're doing is we're looking to correct them in a line of direction. Now this is not something you should do at home because there's a lot of information that's got to determine if that's right. Eric's already had detailed examinations and x-rays, and I know that this is safe for him. Go ahead and hold that there now. Was that stronger?
Yes.
Super. So what we just did is help to connect it. Now it shouldn't stop there because yeah, we do need to pay attention and look inside the shoulder. So some things we might wind up looking at is some rotator cuff muscle tests. Bring your arm up. Is the rotator cuff irritated, arm down a little bit, damaged, or broken? Is there a tear to this, or is it not working right? So we can figure out that, yeah, we may have cervical spine or neck issues, and we may have shoulder issues. You are allowed to have multiple issues. Don't let me push you down. Good. I really like how his rotator cuff works. Now, I'm going to test a few other areas I know break down chronically. One of the first ones I like to do is the biceps tendon. His works really great. And then I like to check how his sternum and clavicle are connecting. Keep that there. Don't let me move you. Elbow straight, keep that there. Looking really good. So just like with the shoulder, we check the joints above it. We also want to be sure to check the area below it. So I'm going to have him bring his arm down, and I'm going to look to see if his elbow's working right. Don't let me flip your wrist. Flip it over. Don't let me flip your wrist. Super. So I like the way the rest of his extremity or his upper extremity is working. These are some of the tests and what an exam should look like for someone who has had difficulty with shoulder pain. Should include the area above and below. If you haven't had that happen, let's look to hop on a discovery call to see how we can figure out a way for you to get to the discovering the problem and getting to the cause. Once again, my name is Dr. Greg. Thank you for letting me be a part of your health.